I did my hand surgery fellowship at the Indiana Hand Center in Indianapolis. Prior to that, I did orthopedic surgery residency in Little Rock, Arkansas. I'm from Louisiana originally. I did my medical school training in LSU in New Orleans. And then prior to that, I did my undergrad at LSU in Baton Rouge, where I ran track and cross country. I decided to specialize in hand surgery pretty early on in my orthopedic residency. I had a great mentor who made hand surgery very exciting, very interesting, but then I genuinely enjoyed the surgical procedures, the anatomy, the goal of restoring function. Hand surgery, although it is a subspecialty, it's still is a pretty broad range of skills that you get to apply to patients. I do the orthopedic side of it, which is fixing the bones, the joints, but then there's also peripheral nerve injuries. So I do peripheral nerve repairs and reconstruction, microsurgery to repair some of the nerves. I get an opportunity to do some vascular surgery, repairing arteries, and also some plastic surgery as well. As an orthopedic hand surgeon, I see a broad spectrum of patients with upper extremity problems. A lot of it's acute injuries. There's a lot of hand trauma, which is lacerations of tendons and nerves, fractures of the hand, of the wrist, up to the elbow. I also see a lot of arthritic conditions, arthritis of the hand, wrist, and the elbow. Compressive neuropathies like carpal tunnel syndrome and cubital tunnel syndrome are very common, so it's a big part of my practice. Also, tendinitis is very common in the hand and wrist, so it's something that I do see quite a bit as well. When a patient comes to see me, they can expect the very best care that I can provide as a hand surgeon. I don't cut corners. I try to make sure that the patients have as much of an understanding as they can about their problem, their condition, and about the goal for the treatment. The most rewarding thing about being a surgeon, it's sometimes doesn't have to do with surgery, but it's genuinely helping someone that really needs my care, my expertise. It usually does have to do with a bad hand issue, but walking someone through a difficult injury or problem is very rewarding. It's nice when things are very simple and they have a very straightforward problem that's fixed and they get better quickly. That is rewarding, but sometimes it's more rewarding to have a more difficult situation that takes longer to recover and to really get a patient to believe in you, trust in you, and get them to where they need to be at the end of it.